people hear about social distancing and, as you called it, physical distancing, I think people are confused or worried. What about the people that are actually in the house with them, family, kids, parents, whatever it is, that might have to go out and then come back into the house?
Yeah. Yeah, that's a risk that we run, and that the Chinese ran when they locked down 930 million people in their country since January the 25th. So typically, what you do is you try to compress all of your shopping. In fact, Americans should begin to be doing that right now. Instead of going out 3 times a week to buy stuff, go out once a week. Compress everything, minimize the amount of time you're out and about. When the person does go out, they should ideally try to wash their hands frequently, not press elevator buttons. The Chinese have all these ingenious things where when you go into an elevator, there's like a little pin cushion of toothpicks, and you take a toothpick, you press your button, and then you discard the toothpick so that you're not touching buttons, because the virus can spread on smooth surfaces. That's called fomites. So a person leaving the household should do that. If someone in the household does get sick and they are tested positive, you can, in principle, isolate that person for 2 weeks from other members of the household. Or in the worst case scenario, they infect the other people in the household, but nevertheless, it's then constrained to one household. Keep in mind that most people infected by this pathogen do fine. Um, the great majority of people will have no symptoms or will have minor symptoms. Some people, however, maybe 25% overall, will get sick. And of those, maybe a fifth of those, so a total of 5% maybe of the people infected will get seriously ill. And then, of course, on average, we don't know exactly how many of the people who are infected will die. And the reason, again, we don't know is we don't have good testing. So we don't know what the denominator is. We don't know, of 10,000 people who are infected, we know that because they were tested, let's say, what happens to them, and how many of them get sick, and how many of them need ICU care, and how many of them die. We don't know that denominator accurately, but our best estimate is that of those infected, somewhere between 0.5% and 1.5% will die, and it is that's a large number, but it's very graded by age. So if you're younger than 25, your risk of death is very small, maybe 0.2%. That's a big risk for a young person, but nevertheless, it's a small risk. And then middle-aged people around 50 or 60, it's about 1%. And then above 80, it's about 20%. So it's a very steep curve with age.
Hey everyone, we're obviously in some uncharted territory with coronavirus, and our plan here is to help you make as much sense of the situation in a non-alarmist fashion as possible. If you're looking for reliable information from experts on the front lines of the pandemic, check out our coronavirus playlist, which we'll keep adding updates to right over here. And to get notified of all future videos, be sure to subscribe.